After the HITECH Act was passed in 2009, a group of senior leaders here at Duke University met to discuss how we should support the President's initiative in health information technology and how we could actually do that academically and pedagogically. And that was the nidus for the creation of MMCi. What we wanted to do was create a program where people could understand the use of health information technology, but more importantly, help us understand how to use that technology to improve the quality and reduce the cost of healthcare. MMCi is really a unique degree. It's not all about health informatics. We do a great job of exposing people, our students, to really the depth and breadth of this, but it's also about business. You know, what we're facing in healthcare are business issues, business organizational issues, and what we've created is a unique model that blends the business approach to health information technology with the technical aspects of the field. We started with a focus on what we wanted people to come out of the MMCi program with, what skills. And those skills really ran to a real understanding of business and organizations, because we're implementing health information technology within organizations, within structures. So we really have to understand how those structures work. But then we wanted to understand the technology itself. Where can we use technology today? How are we thinking about using technology tomorrow? What are the critical issues you have to understand to think about the use of technology appropriately within healthcare? And then more importantly, how do we envision what the boundaries are and how to move that to the next level? We explore that in some of the classroom, but we also explore that in practicums, where you have a real opportunity to really bring your skills together in a real application in an area of your interest. I think most of the American public is still shocked that medical records in the 21st century are kept in pen and paper. That in fact, if you don't go to your old doctor's office to get your records, the new doctor doesn't have that. Even here at Duke, when we went to one practice for our children, they would have the allergy information, and then we went to a different practice, they didn't. So this idea of not having your information available to help your doctors and you make decisions is really a critical shortcoming of the healthcare system. At a macro level, we're talking about issues in terms of the cost and quality of healthcare in the United States, and the idea that we don't have information transparency and information access is a part of that. How do I make sure you're getting your recommendations, your recommended health screening and prevention, your blood pressure or diabetes treated, if I don't have the information about what your laboratory values are, what the previous treatments have been? So very simple things like that, to more complex concepts like you had a CAT scan last year, what does that information look like, and has this test that I just ordered today changed? Is that change meaningful? Is that cancer recurrence? Those are really critical issues that we're facing. So the issues boil down to cost and quality and technology. What we're exploring within MMCi is the relationship between those three. There's a lot of great business strategy literature that suggests technology is not a solution. Technology needs to be coupled with business models, business process improvement, business strategy, if we want to affect change in organizations and organizational structures. Technology enables that business transformation, but doesn't necessarily mandate it. The great thing about MMCi is we're bringing those concepts together in the program, in the classroom. How do we think about using technology? Not developing technology, not technology for its own sake. How do we think about this idea of technology and business model transformation as a way of affecting cost and quality improvements? And at the end of the day, the reason why we're excited as faculty and our students are excited about MMCi is this is actually what we're all after. This is the holy grail of medicine. If I could actually use technology to improve quality and reduce costs, then we've all done our job well.